In India, Hindus have marked the start of spring with their festival of colors known as Holi. Most years, millions of devotees across the country throw colored powder at each other in huge outdoor celebrations. This is not most years. At a time when coronavirus infections in the country are spiking with a growing death toll and more than 60,000 new cases a day, officials have asked people to socially distance and stay home. But they're not. And health experts are worried these unchecked celebrations could turn into COVID superspreader events.
Dancing, singing, and screaming. Thousands packed like sardines on the streets and inside ancient temples. Masks play a performative role. It's exactly what public health officials desperately wanted to avoid. Amid a pandemic that has claimed 160,000 Indian lives. Holi is the festival of joy. We throw colors at each other. We have such a good time together. Nobody gets upset. All our problems are forgotten. Happy Holi. Not all their problems, however. Holi is a celebration of winter giving way to spring. For many, though, it was when hard facts gave way to blind faith. COVID is gone. It will come back after Holi. It's a festival of joy and love. We forget everything. We forget that there is COVID. It was a similar picture in towns and cities across the country as revelers threw caution and colored pigments to the wind. Everyone is maintaining social distancing. We are trying to keep up with the traditions of our family, but by keeping everyone safe. In the capital Delhi, police took a harder line, banning public festivities altogether. The festivals that are being celebrated now, like last night's Shab-e-Barat and today's festival of Holi, these should not be celebrated in public. Instead, it should be celebrated in homes, in small gatherings, so that the coronavirus does not spread. I'm glad to say that these guidelines have been followed to a great extent. Until now, no violations have been reported. The widespread rule-breaking comes at a time of rising infection rates, meaning Indians may well face a prolonged hangover from Holi celebrations that most of them never took part in.
Joining us is Anant Ban, an expert in global health and health policy. He's based in Bhopal, India. Anant, put this celebration and people coming together in context. What impact will these celebrations have?
Thank you for having me. So I think the worry is that since we have had a rebound in the number of cases across many states in India, that the recent weekend where we actually had 3 celebrations, there was the Holi festival, there was also Shab-e-Barat, and Palm Sunday was a venue where a lot of people would have had social interactions happening. Many states did try to put curbs on them, but I think in many places still people went out and obviously did not follow public health precautions in many cases, and that might lead to potential spurt again. It's unfortunate because already in some parts of India the health system is starting to put an alarm out that the number of cases are rapidly rising.
Do you feel that authorities did do enough to try to prevent these gatherings?
Well, in some states, they did announce a requirement for individuals to only celebrate these festivals within their families, within their households, and to not venture out. In other places, it seems that these precautionary warnings were not heeded to, and there have been now a lot of visuals shared of mass celebrations, and those, as we know, can often lead to a clustering of cases. And I guess we will now have to track and see if that indeed holds true. In the meantime, this is a lesson that we need to really make sure that we are putting the brakes on the spread of infection. Otherwise, like last summer, we might have an overburdened health system pretty soon.
Let's put this a bit more in context. There's more than 1.3 billion people in the country. That's a lot of arms that need vaccine jabs. At this rate, how is it looking, and are you worried, particularly given the new, more contagious strains of the coronavirus?
Yes, it's certainly a cause for concern. Only under less than 4% of India's population has received one dose of the vaccine. The number of people who have received both doses is under 1% of the population. So as you can see, there's still a significant section of the population which needs to be covered. And this includes those who are most at risk. Not everyone who's elderly or not everyone who has comorbidity has yet been vaccinated. The interest in getting vaccinated has been low in some parts of the country, and I think that reinforces the importance for more community engagement and outreach to try to get our coverage rates high. Again, vaccination is only one of the efforts. We need to also ensure that there is adherence to public health precautions, and the kind of fatigue that we are seeing in this aspect is something to worry about.
Now, India is a global powerhouse when it comes to vaccine manufacturing. I'm a little curious, are we seeing any vaccine nationalism there the way we've seen it elsewhere? Are people asking, why are we exporting all these vaccines when our citizens need them as much?
It's been certainly, there have been some voices towards that, but to India's credit, I think India has stepped forward and actively exported vaccines to many countries, either through COVAX or through direct deals which the companies manufacturing vaccines in India have done, and the government has facilitated it. That having been said, as we already saw, there is a big gap in terms of number of people who need to be vaccinated in India, and the government has indicated that it might have to ramp up its own domestic need priorities in comparison to allowing exports. So we might see, at least for the next short while, some decrease in exports and an increasing focus on India's domestic vaccination needs. But I'm hopeful that India will continue showing its leadership in terms of sharing vaccines with other parts of the world, especially other low and middle income countries.
Anand Ban, thank you so much for joining us.